Fibrous dysplasia term coined by Lichtenstein. The monostotic form accounts about 70 to 80% cases. It usually involves single bone. The sites can be the skull, ribs, humerus, pelvic bones, or the tibia. The maxilla is more commonly affected than the mandible. The male to female ratio, both are equally affected and it is 1:1. The clinical presentation, the teeth may be drifted, rotated, or it can be the malaligned. The displacement of teeth commonly observed. Unilateral localized swelling of the jaw, which is slow enlarging and painless. The maxillary lesions extend into the zygomatic process, floor of the orbit, or it can extend to the base of skull. Polystotic fibrous dysplasia. It usually affects 20 to 30% cases. The sites involve as the monostotic dysplasia, but there is the involvement of more than 2 bones in it. There is gross swelling, pain, and spontaneous fractures involved in the bone. There is bowing of weight-bearing bones frequently observed, and it may lead to the typical appearance, that is the Shafford crook or the hockey stick deformity. The forms of polystotic fibrous dysplasia includes Jaffe-Lichtenstein syndrome, in which there is bone involvement along with the skin pigmentations, Cafe-Olets pigmentation. The McCune-Albright syndrome, it is just like same as the Jaffe-Lichtenstein syndrome along with the endocrine disturbances. The endocrine disturbances includes hyperthyroidism, hyperparathyroidism, it can be the Cushing syndrome. Craniofacial fibrous dysplasia. The sites of it includes maxilla, frontal bone, zygomatic bone, sphenoid or occipital bones. If there is involvement of the floor of the orbit, then it can lead to hypertelorism or visual impairments, or it can lead to the blindness also. When ear involvement leads to tinnitus or hearing loss. Radiological features includes in initial stages unilocular or multilocular radiolucent areas in the bone. Later, as the lesion matures, a classical ground glass or the peau d'orange appearance going to be visible. The typical features, there is the network of fine bone trabeculae. There is increased trabeculation, which is more opaque and mottled. The classical appearance, that is the ground glass, and the roots of the teeth separated, or it can be moved out of the normal position. The treatment of fibrous dysplasia, it is a self-limiting disease, and the biphosphonates therapy can be prescribed so that it inhibits the osteoclastic activity of the bone resorption. And if there is larger lesions, so for the cosmetic or the functional regions, the surgical resection and reconstruction will be done.